IHTM is bringing together people who are passionate about global health leadership. We are being introduced to a new way of thinking of the several challenges that are facing our resource-limited settings. So here within IHTM, we are in a space where we get to learn from the thought leaders when it comes to global health.
If you look at IHTM over the years, the course has trained future health leaders. If you look at the alumni community, they have become policymakers, they're working in global health institutions, and they're doing groundbreaking research that is currently changing the landscape of global health.
One of the strengths of IHTM is that it helps with challenging key assumptions that we as global health researchers have. And that is something that we need to do more of in the global health community, and this program helps give us the tools to really challenge the necessary assumptions in a multi-dimensional world that exists today.
There's just so much that IHTM is doing so far. First is bringing people from different parts of the world together to understand how their various health systems are. For me, that has been really good. It has been eye-opening because I read some of these things on the news, but when you see someone who has worked there and who can tell you a lot about what it means to be on the ground, then you learn so much from them.
The network is so wide, and I think it's just a matter of time, and even now they are actually networks that are making real impact that have been generated because of IHTM.
There's so much variety in what IHTM teaches us. We're learning about vaccine development, we're learning about adolescents, we're learning about policy, health economics, and we're learning these different things through various methodologies like debate, policy brief, presentations. So I just see it as like this great space to explore different global health topics.
I think by bringing together a group of diverse healthcare professionals and individuals from various countries with a particular emphasis on low and middle income countries, and training us in research methodology and tools for global health equips us to engage in global health challenges, policies, and be ready to be involved in shaping the landscape of global health.
Having this training, we know that when we go back home, we'll be able to address those issues spot on and address really what needs to be done and what needs to be changed in the way health systems have been running so far within our context. So that's very, very important.
Creates a bridge where they can jump from an area where they come from, which can be limited to an area, an arena which is bigger, like the global health. So it creates opportunity for them to work in such areas and bring back those experiences to their country and reflect what they have learned.
In a world where challenges are becoming increasingly complex and multidimensional, we need multi-talented people who can take up this challenge and bring solutions. And I believe that this IHTM course is producing exactly that.